Hi, I'm Dr. Robert Eitches. I'm at Cedars-Sinai Medical Center in Los Angeles. I'd like to talk to you today about how to fight allergies that cause an itchy nose. And that's very appropriate for me because my last name is Eitches. You drop the E and you have itches, and an itchy nose is what I live with and live for and live because of, and people come to see me about. An itchy nose makes you do some things. It makes you go like that sometimes, or you could go like that, or like that, or like that. It's all, some people think they're like ticks. They're not ticks, they're allergies. And why do you have it? You have it because there are allergy cells in your nose called allergy mast cells. They release chemicals that, like histamines and leukotrienes, that make you itch. That's the process. So the deal is, how are we going to reduce this? How are we going to deal with this? How are we going to make this less of an issue? Well, one thing would be decreased exposure. So, you could be the boy in the bubble and live in a bubble and you'd have less exposure, but I don't know if that's practical. You could decrease exposure possibly by moving to the ocean, and that is nice, and that's not always practical either. Sometimes there are seasons that are worse, like springtime's worse. But so let's put you stuck in a situation where you have outdoor exposure, whether or not you like it, even when you're indoors, and it's in the springtime, and you have that itchy nose. So what are you going to do about it? Well, one thing you can do is you can use medications. There are over-the-counter medicines that are like antihistamines and sometimes decongestants that you take orally. Don't use a decongestant as a nasal spray. That causes new problems. And what they'll do is they'll calm the allergy cells down so you have less allergy symptoms. Now, if those don't work, you might look at medicines that are prescriptive. There are other antihistamines that are available, and a lot of times we use nasal sprays. We use nasal sprays that are antihistamine sprays, or nasal sprays that are cortisone sprays, and these are often helpful and sometimes kick in faster with the antihistamine sprays, and the cortisone sprays just calm things down in general. Now, there's also a pill that's a leukotriene antagonist that's used. That's a prescription that's also very good for allergies. What if you don't want to take pills or they're not working? Where do you go then? Well, that's where allergy shots come into play, or allergy immunotherapy, where logistically you get a shot of what you're allergic to in a small dose. You form allergy antibodies that are blocked because of it. They actually form protective antibodies, and over time you get protection rather than allergy. And so you really sort of solve the problem. I'm Dr. Robert Eitches. I'm a board-certified allergist at Cedars-Sinai Medical Center in Los Angeles, and I discussed with you today how to fight allergies that cause an itchy nose. Thank you.